Hello, everyone, and welcome to episode 20 of Real Reflective Practice. I am your host, Dr. Anjalee Perera, aka the Disillusioned Medic. And as always, this live stream is about having the meaningful and open conversations that we doctors don't even realize we create. Our theme this week is variety, and discussing it with me will be Dr. Patrice Baptiste, who is a portfolio GP, a medical educator, a writer, and also the founder of Dream Smart Tutors. We'll be talking, amongst other things, about why some people need variety in their careers, whether we think there's a variety deficiency in the traditional pathways of medicine, and also how doctors can create a more diversified and varied career for themselves. I mean, I can see why this theme of variety is important to you, just talking about the number of things that you do, but it would be great to kind of understand why you picked this theme to talk about tonight.
Because I think it's so important, really. I think often as medics, we see medicine. So before we even get into medical school, we're so obsessed by the thought of becoming a doctor. And then as time goes on, we kind of just get even more narrow-minded and focused on publications and being the best and this specialty and that specialty. And not everyone, but and I think it is changing. But then I think a lot of people do kind of just get a bit lost, a bit kind of institutionalized, lost in this medical bubble. And then some people may become grumpy, may lose their way, may lose themselves. And I think it's really important, not just medicine, but any profession, especially high pressured environments, high pressured jobs, that you do have variety. I think for me, I can't speak for anyone else, but I know that even if we take away being a doctor and medicine, if I was to do writing full time, I don't think I would enjoy it. So for me, doing a number of different things enables me to stay refreshed, rejuvenated, interested. It keeps my interest in a particular career or particular interest. So for me, I think variety is important because and also, so all of that, but also you can develop a number of skills. I could talk forever. But you can really upskill. And like you were saying before, you can become really good at so many different things. I think I was asked a question. I was doing a talk recently about what you said, you can have all these different areas, but you're not really a master of them. But actually, I would argue against that. I would say, actually, you can become really, really good at one particular thing and then another thing as well. So it doesn't have to be, you have to put all your time and effort into one thing and become really, really good at it. You can do things simultaneously. And I think that's a lot of people kind of think that if you have a portfolio career, that actually you're kind of a bit mediocre or whatever it is. I mean, I'm happy to be mediocre. I think I'm a bit mediocre in loads of things. But you can be very successful in more than one career. So
Yeah, no, I mean, it's interesting because I remember, one of the things that people told me when I went into medicine is that there is so much variety. That's what, at school, the kind of spiel, the narrative that I was given, that there are so many specialties, there are so many things you can learn. There's always new research, new discoveries happening in the field. There are fascinating people to meet, both professionally and as patients. And, whilst all this is true, what I found when I actually started practicing was this sense, as I mentioned, this sense of boredom. I wasn't feeling inspired. I wasn't feeling connected to the field in the way that I hoped I would. And I felt like as a junior, I was just doing the same monotonous tasks over and over and over. And I would feel so bad, looking around me and those of my peers and my seniors who seemed to so enjoy the job and, get so much out of it. And it was disappointing. It was really disappointing. And I was so ashamed to admit that, this great career, this great noble profession bored me. It was terrible to confess that. And, and contrast that to now, I feel like I'm constantly using, as you mentioned, different parts of me, different parts of my brain. I'm constantly moving between different tasks. So in fact, I'd probably say I've gone too far the other way in some ways. But I would love to know if any of those experiences resonate with you, and whether you think that perhaps some people need more variety in their careers than others.
Yeah, I think people definitely need variety. It doesn't really matter what you do. I think you do need it. I think, like I said, it helps you feel refreshed. And yeah, I think I think some people, especially a lot of medics that I've met anyway, are quite creative. Especially when you look at, like, if you go back to your personal statement and you see all the things you were doing, a lot of them are probably quite creative things. And I think for me anyway, I can't obviously speak for anyone else, but for me, I'm quite a creative person, and I would argue that I'm probably more creative than I am clinical or academic. Like with writing, like I was saying at a talk I did recently, I can write something very quickly. If we stick to like an opinion piece or an article I write for GP Online, whether that's 500, 600, let's say 900 words, I could probably write a decent, opinion-based article in an hour, maybe less than an hour, because it comes so naturally to me. And I guess because I've been doing it for so long as well, I've got this kind of, I've got template, but I've got this in my head now, and I can pretty much do it quite easily. So that comes with experience. But even before that, like I said, it wouldn't take me that long to write an article. But in terms of medicine, it would take me a long time sometimes to grasp, difficult concepts that you'd look around and you'd see people getting it really quickly. And I'd always have to work really, really hard. But for creative stuff, I mean, it's really easy, So I think you need variety. And I think even if, say, you're not even particularly creative, I think having something creative, it can only add to your life, add to your success, add to whatever it is you want. It just broadens your horizon. So yeah, I love variety. And like I said, I don't think I could be the doctor that I am today if I didn't have all the other things that I do alongside. Even with like YouTube, I've just started I started a few months ago now, my YouTube channel. And although it can be quite hard, a lot of hard work, and editing is not easy, it is very creative. And I do enjoy videos and, talking to the camera and all of that. And that's very creative. And I think it helps me when I go back to work, or when I go and do my writing. Yeah, it just switches things up a little bit, and I feel like I can give more, versus, like you said, just being in the hospital or being in clinical practice and doing the same things over and over again. Because even in general practice, there is loads of variety, but sometimes you can have a clinic and you're seeing, I don't know, urine infections, and that's like half your clinic, or back pain, or whatever it is. And after a while, there's only so much you want to kind of see of the same thing. So yes, I think for me, I think it works very well, and I don't see why for other people it can't work. I think it's just about maybe just looking at things that you might be interested in and seeing how things could work for you, really, and just incorporating it. It doesn't have to take a lot of your time. You don't have to you don't have to work less than full time. You can still have a full-time job or whatever it is you're doing, but you can just spend an hour a week, I don't know, crocheting, or just looking at other things.
Well, this is a very good point. I mean, I guess that a good point to make is that variety is such a personal thing, right? I'm sure there would be many people out there who would find, my professional life now, the work that I do, extremely dull and uninspiring. I'm sure that's the case. And yes, it's not exciting every day. I do still have moments of boredom and feeling like I don't really want to do this. But for the most part, I do find my work very interesting.
It's about finding, your fit, what fits you, what suits your personality. And I think even maybe going a little bit off topic, but it's still relevant. I think a lot of people think, even maybe more of the younger generation as well, that it might be changing. People think that once you pick a career, you just have to stay in that career. Who knows, in 10 years from now, I may say, well, actually, I don't want to do general practice, or I don't want to be a doctor anymore. And there's no problem with that. I know many people who have spent years in medicine and then decided, actually, medicine has had its run. I've done everything I think I want to do in medicine, and now it's time to do something different, whether that's retraining to do law, or just doing something completely different. Maybe not even a profession like law, medicine, whatever, something completely different, something more creative. So I think everyone is different, and there's not a one size fits all approach. You just have to find your way, and it's a journey. And when I look back at when I took my year out, I wish that I spent more time just enjoying that year versus thinking, oh gosh, I'm losing time. I have to like pick a career. I have to go back. I have to do this. I have to do that. I wish I just, was in the moment. I wish I was in the present. And I think I spend a lot of my time consciously trying to do that. If I find my mind wandering, we're really going off topic, but if I find my mind wandering, I'm always like, come back, be in the present, whatever that may be, what is surrounding me. Because I find sometimes that we're just always in the future in a lot of the things that we do. And I like to plan. It's good to plan, but I think sometimes we can get a bit carried away with being in the future too much and just forgetting, and even looking back on the past and all our achievements. I think sometimes we forget that we've done so much already, and that we're in a really good place, and that there are many people who might want to be in our shoes, in our position. And so I think we need to just consciously make that effort to just think about where we are. We're on a journey. We're not this, we're different people. My life is different to your life, and I think it's just looking at yourself and just finding what will work for you, whether that's career or otherwise.
Yeah, no, I mean, I think you hit on a very important point when you mentioned that, people, it's okay to have variety in your career, because I think perhaps one of the limitations within medicine is this idea that I come across so often that, the only reason why you would not be a full-time doctor and dedicate your life to it is because there's something wrong. So, you'd only go less than full-time if you had a chronic illness, or if you, became a parent and then, were juggling childcare and work and couldn't make that happen. And then this idea that, if you leave medicine, it's because you weren't good enough, or you weren't cut out for it, or that you're a lazy person who couldn't make it.
Or if you choose general practice. You're lazy.
Well, exactly, yeah.
Easy job and took the easy route out. Yeah, all of that.
Exactly. So these attitudes, I think, really hold us back from variety, and this judgment that we automatically make that variety isn't something that you can aspire to as a doctor, because for some bizarre reason we need to dedicate our entire lives to it.
Yeah, no, I think we need to just have a different perspective, and it's just the way the environment is, it's the way society is, it's the way we've been trained to think. And I think we need to retrain our brains and be more open-minded.
Yeah, no, I mean, I do. I mean, I wanted to talk to you about this, whether the traditional pathways of medicine, hold us back from variety, whether there's a deficiency of variety in the current training pathways. And I really think there is, because I think for me, part of the difficulty is there is this huge pressure, right, to specialize early, to decide what you want to do. We know that the profession over the last couple of decades has become more and more super specialized. And so while the medical field itself is vast, is diverse, and has many different facets to it, as one individual doctor, you're only focusing on perhaps a small part of it at a time, right? And I think also the types of skills that you're expected to employ as a doctor, they're nearly always the same until you reach a slightly more senior level, at which point you might have more managerial responsibilities, for example, something like that. But as a junior, you've got your clinical and practical skills, you've got your time management, your prioritization skills, you've got your patient and team relationship skills. But beyond those things, you're not often challenged. I mean, since leaving medicine, I've picked up on so many skills like creativity, as you mentioned, and strategic thinking, leadership, team management, recruitment, organizational effectiveness. I mean, there's so many things that I've learned since I left. And I feel like in medicine, if you want to do something, it has to be in your spare time. You have to go less than full time. You have to take a year out, or it's an unpaid position, like the clinical entrepreneurship program, which of course does create a barrier for doctors who might financially be struggling, or might find it difficult to make a move like that in their life. So I just feel that the diversification of skills isn't really valued within medicine. When the main focus is on service provision rather than professional development, if that makes sense.
Oh, you've hit the nail on the head. It is about service provision. We're taught to be employees. We're not taught to really think for ourselves. We're just taught to do this job and that's it, which is very sad, because there are many talented people, forget creativity, but just very talented, highly skilled professionals in medicine, and like you said, their potential is probably not being met and being stifled. So it is sad. It is about service provision, which is why training sometimes isn't fun. I wish I could have enjoyed more of my training programs versus just saying, oh gosh, I'll be at the end, I'll be a GP. I wish that there was more time to have courses or have things that may not necessarily be medicine or medically related, but would help me in my role as a doctor. I think it goes back to also, being in the government, publicly funded. Like I said, we're taught to be employees, So I think unless things kind of change overall, it's probably going to stay that way. And like you said, you have to do things on your own. You have to then source people out who may not even be medics to develop these other skills, and go to non-medical events and conferences and courses and do things in your own time, like upskill in other areas, whether that's leadership, business, whatever it is. Just going a bit off topic, on my YouTube channel, I'm going to do a series about finances for medics, because it's something, again, it's a skill that we're not taught. A lot of people don't even check their pay slip, or they just don't even know.
That's so true. I'm so much more financially literate since leaving medicine. You're absolutely right.
When I started, no one taught me how to read a pay slip. I just took it. Sometimes I wouldn't even get my pay slip. I would just see I get paid roughly the same amount, and then that would be it. Okay. Medics, I think even medics who think that they're financially savvy are not financially savvy. I think, you have to do a lot of the work yourself, and I think it's just the nature of medicine, of the job in this country, and I think it should be changed, but unfortunately it probably won't be. It's the onus is on yourself, and if you're not happy, like you did, you change your career, or if you feel you're not happy with one aspect, try and change it in some way. There are ways you can tweak things. Like for me, I chose general practice for so many reasons, and one of those reasons, like I said, was career autonomy. I can do so many different things in general practice. I can go down to 1 day a week if I really wanted to. I can go up even more sessions. I can upskill and then do clinics in, I don't know, obs and gynae or something, or inserting coils and contraception, etc. So there's loads of things that I can do that interest me, and it allows me to have that control. I can work nights if I want to. I can work weekends. I can do all of that if I really want to. I can work for NHS 111, so there's so many. I have that control, and I just felt very frustrated in the hospital, because with the rota, you wouldn't get your rota. Again, we're going off topic here, but you wouldn't get your rota, you can't plan your life, everyone's going here and everywhere, and you're just like, well, I don't have my rota yet, so I can't answer you, I can't tell you if I can come. It just sounds very pathetic, you're, I don't know, 25, 30, and you still can't plan your life. So I think there are deep-rooted things in the NHS and the way it's structured and the people who are there and the managers, etc. We can talk about this forever, but I think there are a lot of deep-rooted things that probably won't change in the foreseeable or the near future. But I think if it did change, we'd be able to retain doctors like yourself.
Absolutely. I mean, you're right. They do make it very, very difficult to get that variety in your career, and it's such a shame. And I think in that vein, we're talking about the fact that there is an individual onus on the individual to do that. That there is a certain amount of extra effort that you have to make, and a process of learning that you have to go through in order to diversify. So I think it would be good here to talk about the benefits. Why go through all of that trouble to diversify and create variety in your career? What's the point? And I think for me personally, a huge part of the conversation about variety is about burnout. Because one of my favorite facts about burnout, which you kind of alluded to earlier, is the fact that you can get burnt out doing something you love. It's one of the reasons I'm really, really careful about how much time I dedicate to each of my pursuits, because I know I'm a workaholic. I know that about myself. I am prone to working too hard and too long. I love my coaching work so much that I would never want to start hating it. So I have to be really controlled about it. But having professional variety for me does help with this, because it means that I can't completely dedicate myself to one thing. It's just not possible, thanks to my career. And I think we've got Patrice back now. So.
We were doing so well.
You were doing so well. So Patrice, what does variety bring to you in your life?
Yeah, I think you summed it up really well, actually. Like I was saying at the start, it enables me to stay refreshed. Like I said, if I was to do writing, that's why I turned down the job. I was offered a job at the medical communications company to be like a junior writer or associate medical writer. I can't remember what it was, but it was an entry-level position. And I really thought about it, but I just didn't see myself, working and writing full time. I would have left again. So for me, it works really well where I can dedicate a portion of my week or month to writing for GP Online, for Blue Stream Academy, for writing for whatever else other place I want to write for, or writing for my own blog or website or whatever it is. I think it also comes back to being bored. I get really bored quite easily. Whether that's a sign of high intelligence, I don't know. But I get really bored. Which is why I'm always on the go, like yourself. You say that your career, it's quite hectic. And I think there's just type of person, you thrive off of that. You enjoy that. That keeps you going. That keeps you motivated. And yeah, I think having variety and I think it's also about having the ability to have variety versus someone just telling you this is how it's going to be. I think there's something that comes from being able to set your own kind of standards, like being an entrepreneur. You can decide. It's very hard, but you can decide a lot of different things versus as an employee, there's a lot of things you can't also decide. So I think for me, it's also about having that control, having that flexibility, being refreshed, and just not getting burnt out, like you said, and not getting bored with one particular thing. So I think that's everything in a nutshell about variety. I couldn't see, and I didn't even know what a portfolio career was. Like many medics, and not just medics, many people don't know what a portfolio career is. It's not like a traditional career. It's multiple careers, isn't it? But I think if I'd have known about that earlier on, I probably wouldn't have had so much angst. I would have been much happier early on.
No, I absolutely agree with you.
Spread it around, tell everyone, have a portfolio career. It doesn't work for everyone, like we're saying, type of person. It has to suit you, which is why variety, I think it would work for many people. But for some people, they're happy, they want to stick with one particular thing. They want to be really, really good and really, really niche. That works for them. But for like us, our type of personalities, variety, creativity, all of that, it suits us. So I took my year out. I relearned who I was, and I think I lost a bit of who I was when I started working as a doctor, because like you said, it's long hours, you're dedicating a lot, you're giving a lot of yourself, and as a giver, we need to be refilled. We need to also have someone give to us, and it can be quite draining emotionally, mentally, physically, and so I think, like you said, which I'm sure I've written an article about this, which is about part-time working. I think it should be the norm as well. And I think that way we would not have a lot of the staffing issues that we have. People think, oh, that doesn't really make sense. But it does, because even when I was locuming, people were doing, trainings were doing job shares, which can work. It can work really well. I think it's just about how you do it. So I'm all for part-time working, and I think it should be made more acceptable, and it shouldn't be something that's, why are you working part-time? Do you not want to do medicine? Do you not enjoy your job? I mean, why are you doing that? How can you be a really good doctor if you're part-time? All these things that people think and people say, it doesn't help things. And I think if we're going to look for longevity in our careers, for me anyway, I want to be a GP for a while yet. For me, the only way I can see doing that, not getting burnt out and staying a GP for a while, is breaking it up and keeping myself rejuvenated, refreshed, and also writing, whatever else that I do. I want to do it for a while. I enjoy it, and like you said, you don't want to become burnt out. You don't want to hate it or not enjoy it anymore. So I think the way to do that is to embrace part-time working. I mean, there are kind of out of program training experience, or time out of program programs that you can do depending on your training or where you are in your training. So I think if people don't know about that, they should look into that, because even with general practice, when you're a GP, you can even take a career break, I think up to 2 years. After that, you have to obviously do a bit of retraining, etc. But there are things out there I think people just don't know as well. So do your research, know about yourself.
Fantastic. Patrice, thank you so much. It's been such a pleasure talking to you.
Thank you.
Have a lovely evening.
Thanks, Angie. Take care. Bye.
Take care. Bye.